Welcome to our training session on workplace diversity and inclusion. Training objectives. Understand the definitions of diversity and inclusion. Recognize the benefits of diversity in patient care, collaboration, and employee engagement. Identify the visible and invisible dimensions of diversity. Develop skills to address bias, discrimination, and create an inclusive environment. Improve communication and conflict resolution strategies. Defining diversity and inclusion. Diversity, the presence of differences in race, ethnicity, gender, age, sexual orientation, and more. Inclusion, actively creating environments where everyone feels respected, valued, and empowered. Key takeaway. Diversity drives innovation, inclusion ensures everyone has a voice. Key benefits of diversity. Improved patient care, diverse perspectives help tailor care to individual needs. Better problem solving, different viewpoints spark creative solutions for complex challenges. Increased empathy and trust. Diverse teams build stronger connections, improving care quality and patient satisfaction. Enhanced employee engagement, diverse teams foster a positive work culture, boosting job satisfaction and retention. Why diversity matters in home health care. Cultural competence, understanding and respecting cultural differences leads to better patient outcomes. Workplace support, an inclusive work environment reduces turnover and promotes collaboration. Legal compliance. Follows anti-discrimination laws to protect both employees and individuals. Dimensions of diversity. Primary dimensions: race, gender, age, ethnicity, physical abilities. Secondary dimensions: education, marital status, religion, socioeconomic status. Visible diversity: observable traits like race, gender, and physical ability. Invisible diversity: factors like cultural background, mental health, and personal experiences. Identity in the workplace. Personal identity includes traits like personality, values, and life experiences. Cultural identity, shaped by cultural background, traditions, and beliefs, influencing caregiving and work dynamics. Group identity, shared goals or characteristics within teams that promote collaboration or can lead to exclusion. Key point: embracing diverse identities fosters inclusion and improves team dynamics. Unconscious bias and microaggressions. Unconscious bias, automatic judgments based on stereotypes or personal experiences. Microaggressions, subtle, often unintentional comments or actions that can harm or exclude others. Action, work on self-awareness to recognize and address biases and microaggressions. Discrimination in the workplace. Direct discrimination, overt unfair treatment based on characteristics like race, gender, or disability. Indirect discrimination, unintended negative impacts of policies or practices. Common types: racial, gender, age, disability, and religious discrimination. Key action: recognize and address discrimination promptly to maintain an inclusive environment. Legal framework and protections. Title VII of the Civil Rights Act prohibits discrimination in employment based on race, color, religion, sex, and national origin. Americans with Disabilities Act, ADA, ensures reasonable accommodations for individuals with disabilities. Age Discrimination in Employment Act, ADEA, protects employees 40 years old or older from age-based discrimination. State protections. Connecticut Human Rights Act offers additional safeguards against discrimination. Standards for serving diverse populations. Culturally competent care, understand cultural differences in health practices and needs. Language services, provide assistance to bridge language barriers. Patient-centered approach, respect dietary restrictions. Religious practices and personal preferences. Action, continuously educate staff and provide resources to address diverse needs. Promoting diversity and inclusion. Foster an inclusive culture, create a work environment where every individual is respected, valued, and empowered. Encourage dialogue, promote open conversations about diversity and inclusion. Led by example. Show respect for diversity through actions and communication. Collaborative practices, encourage teamwork across different cultural, social, and professional backgrounds. Conflict and communication in a diverse workplace. Conflict can arise from cultural differences, communication styles, or personal values. Effective communication, use inclusive language and adapt to others' cultural or linguistic needs. Conflict resolution. Address issues early, promote empathy, and foster open dialogue. Key point: respectful communication and conflict management strengthen teamwork. Building positive patient relationships. Empathy, demonstrate understanding and patience toward individuals from diverse backgrounds. Trust, build rapport by respecting cultural preferences and being attentive to needs. Patient-centered care. Tailor care plans to fit the individual, considering their cultural and personal values. Key point: inclusive, empathetic care leads to better individual outcomes. Conclusion and key takeaways. Commit to diversity. Diversity enhances care quality and team dynamics. Respect and inclusion, treat all colleagues and patients with dignity and fairness. Ongoing learning, reflect on your own biases and seek continuous improvement in diversity practices. Final thought: a diverse and inclusive workplace leads to better care, stronger teams, and a healthier work environment. Thank you for watching the Workplace Diversity and Inclusion module. Please answer the questions for this training before moving on to the next training module.